to the Point with Michael Williams.
The opioid crisis, a statewide public health emergency as declared by the governor now. What are possible answers to ending these drug overdoses that are claiming hundreds upon hundreds, if not thousands of lives here and nationally? Good morning and welcome. With the trend of overdoses and deaths from opioids on the rise, we decided to take a closer look at what it will take to combat that trend. We're looking at it from the law enforcement and medical perspective. Joining me, Martin County Sheriff William Snyder, a familiar face on our broadcast, and Dr. Raphael Wald, a psychologist who has treated patients addicted to opioids. We thank you both for coming in. From a law enforcement perspective first, Martin County is an outlier in the sense that in terms of opioid-related deaths, you've seen some decline. By the numbers, what are you looking at? What do you attribute it to?
Well, last year, Mike, we had roughly 300 known overdoses, opioid class overdoses that the sheriff's office responded to. Towards the end of the year, we did a full-blown commitment to trying to stop the source and the spread, and our statistics went down to almost 0 a month. Unfortunately, this year, we're seeing the trend start to creep back up.
Doctor, first for definition. People talk heroin, opioids. We use the terms interchangeably sometimes. Clarify what we're talking about when we talk about this crisis. Sometimes inadvertently we use the terms interchangeably.
Opioids are a class of drug. Underneath that class of drug, heroin is one of the many drugs that people use. There are also prescription narcotics like oxycodone and Percocet. So those are all under the general category of this class called opioids.
And heroin being cut with other drugs that makes it that much more addictive and deadly, correct? First you, then you, Sheriff.
Yes, that's correct. Heroin is extremely addictive. The truth is, overall, opioids are the most addictive class of drugs that are being used today. The relapse rate is a little bit depressing. The overwhelming majority of people who truly are addicted to opioids or narcotics are going to relapse at some point in their life. It's only a small percentage that ultimately lives the rest of their life drug-free.
Why the explosion? First you, doctor, then you, Sheriff.
I think, in my opinion, I think it's because of how addictive the drugs are and the fact that they're being prescribed a little bit more frequently. It's really, other than anti-inflammatories, it's the main go-to drug for analgesia or pain relief.
But Sheriff, you wore two hats. So once as state lawmaker, now as a multi-term sheriff in Martin County, and you've seen it from both perspectives. As a legislator, you told me even before the broadcast, you were worried about this possibility of this happening. Take us back 5, 10, 15 years ago and where we are today and why we're seeing this explosion.
Well, in 2010, 12, and then 14, the Florida legislature was grappling with the pill mill phenomenon. And we passed a bill that in effect ended that pill mill problem, which really gave rise to what we have today with the opioid crisis. I said actually in open committee that when we passed that bill, the unfortunate side effect would be that we would see an increase in heroin use, and unfortunately that prophecy's come true.
Connect the dots. So people, as you have said to me, went from abusing pharmaceutically approved drugs to now finding them on the illicit marketplace, all for the same underlying reason, to try and manage pain or other issues that they're having?
Well, what can happen, and what does happen often, we see two classes of drug addict. We see the classic drug addict who is just chasing a high using heroin. Then we see the quote-unquote law-abiding person who goes to a doctor, gets a prescription for oxycodone, oxycontin, some kind of hydromorphone opioid drug. The prescription runs out. They've enjoyed the sensation, maybe overused it. They become addicted. Then they turn to street source drugs, which is heroin. Heroin will give them the same sensation.
Doctor?
Right. I think going to the second group of people with addiction that we were talking about, people get prescribed these narcotics, and a lot of doctors are not comfortable prescribing narcotic medication beyond a certain point. For example, if someone is after surgery, and once a person is beyond a certain point, most doctors feel after surgery they shouldn't need those narcotics. So once that use continues, patients will go to different doctors trying to find one that will prescribe it.
And if they don't find it, they might find it illicitly on the streets, as the sheriff is describing.
Right, and another problem is that people do escalate. So for example, they might be taking a drug like oxycodone orally, but when that doesn't provide a high anymore, they increase the dose. And once that doesn't help anymore, they might turn to a street drug. And there are different ways of administering a street drug like heroin. If you smoke it, it doesn't give you quite the same high as if you inject it intravenously.
Let's go back to the fight you're having on the street, Sheriff, and I'd like to also offer some perspective from the largest of our 5 counties, Palm Beach County. Dr. Michael Bell, the medical examiner, said in a recent review by the Palm Beach Post, "I don't see any stop." He's that concerned. 590 opioid overdose deaths in 2016. This was a Palm Beach Post in-depth article, an all-time high for the county, nearly twice as many as the year before. You had said you'd seen a downturn in Martin County, but now an increase. Talk from that law enforcement perspective about the things that worked for you, the things we need to be doing more of. Because when you hear a medical examiner calling this a crisis to which he sees no stop, it chills all of us.
We've had 8 deaths so far this year already in opioid overdose. Could have been heroin, could have been a heroin-fentanyl combination. Fentanyl is really the boogeyman in all of this. It's an analgesic knockoff of heroin. Extremely addictive, extremely dangerous, extremely powerful. So we're seeing people abusing that. I think you have here between the doctor and myself, there's 3 possible approaches. There's treatment, there's law enforcement. The biggest approach is family and prevention. And I think that, as the good medical doctor said, I don't see an end in sight. And we just have to continue working as a society to send the right message to our children and to our grown children that drowning your sorrows in opioids is a prescription for your own demise.
What were the things that were working for you from a law enforcement perspective that you can touch on that you'll perhaps tweak or do more of? And we should add that every department, be it law enforcement or our first responders in terms of paramedics, are being strained to the limits, and not only in our region, but statewide and nationwide. And we'll talk about the public health emergency in a moment. But from where you sit, what more can be done or tweaked from your perspective?
We're continuing our all-out effort to reduce the supply and to enforce the laws as they exist. But we're also about to engage in a program where we have civilian first responders, not quite at the doctor's level, but at a master's level, that will go with our deputies to these overdoses and try to begin a long-term solution approach.
When will that kick off?
Well, we have a funding request into the legislature. It's in both the House and the Senate. If the governor signs it, we'll be kicking it off in the next budget year.
An effort to really put help right there, not just at the scene of an arrest or an initial intervention, but something that goes long term.
Right.
Would that be one of the first of its kind in the state?
It's the first one it'll be the first one in Florida. It's one of the first, it'll probably be one of the first in the nation where you actually have civilians working for a sheriff's office, co-responding with that first responder deputy that has the treatment skill set and education to put a marker down and actually begin some kind of a holistic program for recovery.
The governor has declared a public health emergency, millions of dollars that can be put towards fighting this. Some have criticized him, saying it should have come sooner. Others said, at least we now have the declaration. From a practical point of view, from where you sit clinically, what will it mean, this public health emergency being declared?
I don't think that in terms of each individual, unless the access to the drug is cut off, I don't think there's necessarily going to be an end in sight, just as we've said before. I think that access to the drug needs to be cut off. The addiction rate with opioids is so much higher than any other class of drug. That's why this drug emergency, this drug crisis, as it relates to opioids, is so much more serious than ones we've had in the past. If a person, depending on the study that you read, the relapse rate over the course of several years is 90%. And that's for people that are trying to get clean.
But the public health emergency, according to everything we understand, will allow the state to accept federal grants that go toward prevention, treatment, recovery services, $54 million. Many argue it's a drop in the bucket, but a start. And it's the kind of thing you've talked about, that this is going to have to be a holistic approach, that we can't do it just with arrest. We can't do it just with taking them off the streets. And you can't expect somebody who's on these and addicted to them to suddenly say, I stop. It's going to have to be an all-in, long-term approach.
Correct, absolutely. One of the most important things in treating people that have this sort of addiction is taking away the secondary reinforcers, and that's everything that surrounds their drug use. So, for example, it can be as simple as if a person used to always have a cup of coffee right before they shot heroin, coffee is going to be a major trigger for that person. If there was a certain group of people that they always used to spend time with when they were shooting heroin, they're going to need to stay away from those people. Those secondary reinforcers are among the biggest risks for people that are trying to recover from addiction.
How badly are we in need of much more in terms of the network of prevention and treatment services for these people long term? The types of things the sheriff, for instance, has talked about in terms of building and weaving a network around these people to help them and to try and get people from getting hooked to begin with.
Desperately. We're desperately in need of that, and I think it goes just beyond the acute phase of treatment. So some people go into an inpatient treatment facility and they're in that facility for 30 or 60 or 90 days. But after that is really when the real fight happens.
So the $54 million is a drop in the bucket, you're saying, that they're talking about with this public health emergency. This has to be something systemic and sustained.
It's a drop in the bucket, but it's a great start.
Sheriff, also, no matter how many times we do stories like this, you're familiar with this, there are some people say, well, it's really awful, but that's happening over there. That's not me. Put to rest
let me disabuse people of that. We used to say the heroin user was a down and outer. It was somebody in a lower socioeconomic neighborhood, a ne'er-do-well, and a loser. The classic heroin user profile of yesterday. Today, I call them the up and outers. These are people who have good families, had good jobs, they've been firefighters, they've been law enforcement, they've been in the ministry, every walk of life. Everybody has a touch with these kind of pain pills. You have a tooth pulled, a surgery, and so the temptation is, the segue into it is out there for all of us. Some people have addictive personalities. And so this idea that somehow it's in another neighborhood is completely false. I will tell you this, every neighborhood in Martin County is affected by it, and one of the new drug czars on the President's opioid commission maintains that 1 in 3 families is affected directly by opioid abuse.
It's a national health crisis.
Absolutely.
And the long-term impact, as you said, law enforcement, prevention, treatment, and hopefully coming up with a new class of far less addictive painkillers, because we've now bounced from a pill mill problem to this opioid crisis, and people are saying, what's next? And we're straining at the limit. Doctor, is there any hope on that front?
One thing I just wanted to add to
Sure,
what the sheriff was saying is that it certainly doesn't discriminate whether a person has a genetic predisposition towards addiction and abuse of drugs. That doesn't discriminate based on how much money you have in the bank. That is a problem, just like you said, that affects everybody.
Any hope on the science frontier? I've read a bit about the effort to try and come up with things that will alleviate people's pain crises, but with drugs that are far less addictive than what we're seeing happening on our streets today.
A lot of the research that's happening works with those receptors in the brain that are affected when a person is in pain. The problem is that we're not finding that those medications are as helpful as you would think they would be in theory. The brain is the most complicated entity in the galaxy, so something we write out on paper that should work generally won't.
Sheriff, closing comment with any kind of problem where there's a need or demand for this, there are people willing to illicitly and criminally supply it. Close with your thoughts on that and your final thoughts on this crisis and where we go from here.
Well, my thought is this, that the ultimate solution to this would be a national revival of family values, of neighbor helping neighbor, of families being alert to this possible problem. Law enforcement has an enormous important role in this. We have to work at getting the source. But at the end of the day, if I could leave you with one word picture illustration, it would be a response with the doctor in the passenger seat, me in the driver's seat, and a team of professionals waiting to help us as we go case by case and try to pull people out of this addictive lifestyle.
But it's not going to happen if person by person, family by family, community by community, we're not all in.
We've got to be all in.
Sheriff, thank you very much. Sheriff William Snyder, Dr. Wald, we appreciate your expertise. We know it's a topic we're going to be talking about a lot more with both of you, unfortunately, both in the field as you try and prevent this, as you try and treat it. And again, nobody can be on the sidelines on this one. We appreciate your perspective. Coming up next, the Florida legislative session wrapping up. Winners and losers, we'll talk a bit about that in a moment.